Understanding neurogenic versus idiopathic overactive bladder. Imagine feeling a sudden, urgent need to go to the bathroom that you just can't ignore. That's a common experience for people with overactive bladder. But did you know there are different reasons behind this condition? Today, we're exploring the differences between neurogenic and idiopathic overactive bladder, two types that share symptoms but have different causes. Overactive bladder is a condition where the bladder muscles contract too often or involuntarily, leading to symptoms like frequent urination, urgency, and sometimes leakage. It happens because the nerves that control the bladder send signals that cause the bladder muscle to contract when it shouldn't. This abnormal activity results in the urgent feelings many people experience. Now, neurogenic overactive bladder occurs when there is a problem with the nerves that communicate with the bladder. This can happen due to neurological conditions or injuries that affect nerve signals. For example, if someone has a spinal cord injury, multiple sclerosis, Parkinson's disease, or has had a stroke, these conditions can interfere with how the nerves tell the bladder when to fill and empty. When nerve signals are disrupted, the bladder may contract involuntarily or too often, leading to symptoms of overactive bladder. Essentially, the nerve pathways that normally regulate bladder activity are damaged or impaired. On the other hand, idiopathic overactive bladder means there is no clear neurological or medical reason for the symptoms. Despite thorough testing, doctors cannot find an injury, disease, or nerve problem causing the overactivity. The exact cause isn't fully understood, but it's believed that the bladder muscles may become overly sensitive or the signaling pathways may be abnormal without a specific neurological issue. Idiopathic overactive bladder is the most common form and is often diagnosed after ruling out other causes like infections, stones, or neurological conditions. Understanding these differences is important because treatment can vary. Neurogenic overactive bladder might require specialized management, including medications, nerve stimulation, or other therapies tailored to the neurological condition. For idiopathic cases, treatments often include behavioral therapies like bladder training, pelvic floor exercises, and medications to help control symptoms. It's also important to consider that bladder symptoms can sometimes be caused by other conditions, including bladder cancer. Symptoms like urgency and frequency can overlap, so proper evaluation by a healthcare professional is essential to rule out serious issues. Maintaining bladder health involves managing contributing factors such as infections, obstructions, and neurological health, and staying vigilant for any signs that could indicate more serious conditions. In summary, neurogenic overactive bladder results from nerve damage affecting bladder control, often linked to neurological diseases or injuries. Idiopathic overactive bladder occurs without a known cause, likely involving abnormal bladder muscle activity. Both types requiring accurate diagnosis and personalized treatment to help manage symptoms and protect bladder health. If you experience persistent bladder symptoms, always consult a healthcare provider for proper assessment and care.